Osteoporosis comes from the Greek terminology porous bone. This is a disease which causes a reduction in the density and quality of bone within the human body. This process occurs silently and progressively. Diagnosis is normally given after a sufferer has been hospitalized with a fracture. 1 in 2 women and 1 in 5 men over the age of 50 will sustain a bone fracture due to weakened bones. In the UK, it has been reported that there are 300,000 fragility fractures per year. 70,000 of these fractures are associated with hip fractures. In the UK, there is a resulting 1,150 death rate per month from hip fractures. The IOF states that roughly 30% of postmenopausal women will suffer from osteoporosis in the UK and the USA. 40% of these women and 15 to 30% of men will suffer one or more fragility fracture in their remaining lifetime. Osteoporosis injuries predominantly result into prolonged hospitalization and decreased independency, with a total cost of hip fractures being £2 million. In the UK, 68% of patients stop taking their medication after 12 months.
Osteoporosis is a condition that takes place when the bones are weakened, and the rate of bone weakening is usually much higher than that of replacement, and as a result of this, bone cells cannot repair and strengthen themselves quickly, and the normal bone cavities become larger in osteoporosis, and this means the bones are more fragile and therefore are at high risk of breaking. A loss of bone mass or density usually takes place when bone lose minerals such as calcium at a faster rate than it being replaced, and therefore this results in thinner and less dense bones and causing a person to experience fractures more easily. And osteoporosis is also known as a systemic disorder where it affects the entire skeleton. The skeleton is a framework of bones. Bone is a type of connective tissue that has many basic functions, such as storage of minerals, supporting the movement of the body by allowing attachments for skeletal muscles that pull on the bones, which act as levers, and also supports and protects vital organs such as the lungs, the heart, the spinal cord, and the brain, and just general support of the body. The shape and structure of bones continuously changes throughout a person's life. Development and growth of bone starts forming during the first 6 weeks after fertilization has taken place. So intramembranous bones form between the layers of connective tissue. And development of these bones start when unspecialized connective tissue form at the position where future potential bones will develop. And when extracellular matrix around the osteoblasts is then basically termed as osteocytes. And the surrounding membranous tissue is what forms the periosteum of a bone. And inside the periosteum, the osteoblasts form a compact bone layer that goes over the new spongy bone. And endochondral bones first start off as cartilaginous masses, however they're then replaced with bone tissue, and the bones develop from hyaline cartilage, which is shaped the same way that future bones will later become.
Pathophysiology, bone remodeling and the effects of hormones. The process of bone demolition and reconstruction occurs within a temporary structure called the basic multicellular unit. Osteoclasts are found in tiny pits in cancellous bone known as house-shaped lacunae. They are responsible for bone resorption. The resorption phase in bone remodeling should be short. Any increase in osteoclast activity will result in a loss of bone mass. Cortical bone is made from osteoids or Hayesian systems. These systems are made from layers called lamellae and are important for the structure. Osteocytes are derived from osteoblasts and occupy the lacuna. Osteoblasts, formed from mesenchymal stem cells, are involved in bone remodeling. They act as pump cells to cause calcification and decalcification of the bone. Bone remodeling is regulated by calcitropic hormones, thyroid and parathyroid. Any unfilled house-shaped lacunae and Hayesian canals leads to weakening of the bones. Estrogen stimulates the production of transforming growth factor, which increases apoptosis of osteoclasts. However, after menopause, the levels of estrogen in women rapidly decrease. This leads to a rapid decrease in bone density. Testosterone. A small amount of testosterone, the male sex hormone, is converted into estrogen. Lower levels of testosterone mean lower levels of estrogen conversion, which in turn reduces bone mass.
Signs and symptoms of osteoporosis. Loss of height, curved upper back, formation of the hump. No other symptoms can be noticed until the first fractures. On top of that, bone fractures occurs much more easily. Back pain caused by fractured bones is also very common. Who's at risk? People with calcium and vitamin D deficiencies, people with low body mass indexes, elderly people, and physically not active people. Also people with low testosterone and estrogen levels. Silent disease. Osteoporosis takes place at slow rate, weakening the bones until they break. Most people are not aware that they have osteoporosis until bone densitometry test is performed. Osteoporosis can develop as soon as person reaches adulthood. This is due to loss in hormone activity, physical activity, or dietary changes. The disease develops really slowly, thus it's very hard to diagnose in the early stages. Faster development occurs when modifiable risk factors take place. Risk factors for osteoporosis are fixed and modifiable. Fixed risks are age, gender, ethnicity, fractures, family members with previous illness, menopause, and hysterectomy. Modifiable ones are alcohol, tobacco, low body mass index, poor nutrition, eating disorders, frequent falls and injuries, and steroid use. Osteoporosis in men. Osteoporosis was previously seen only as a woman disease, but researchers over the years show that men are equally susceptible to osteoporosis. 5% of men over age of 65 have osteoporosis. Testosterone deficiency is most common cause. Physical activity is proven to slow down loss of bone mass. This explains fewer cases reported as men tend to be more physically active. Early access to tobacco, alcohol interferes with bone mass peaking in teenage years, speeding up loss of bone mass later in lifetime.
Diagnosis. It is important to identify patients at risk of osteoporosis to allow for prevention and medical treatment at the early phase of the disease. Early diagnosis is achieved with physical examination, looking at the condition of bones and any previous fractures, and by taking into consideration clinical factors and historical factors. With this information, practitioners use FRAX to identify patients at risk and to calculate the risk of fractures. All women after menopause and men over the age of 50 should be evaluated to decide if they need BMD testing. Bone densitometry is the technique used to measure BMD and therefore the condition of bones. The method of choice to diagnose osteoporosis is DXA because of its accuracy, resolution, quick scan time, and low radiation. Osteoporosis is diagnosed as T-score of -2.5 or lower. There are two types of drug used to treat osteoporosis: anti-resorptive and anabolic. Anti-resorptive drugs slow bone remodeling and increase bone density, and they include bisphosphonates, estrogens, SERMs, and calcitonin. Anabolic drugs build new bone, and currently the only anabolic drug used is parathyroid hormone teripatate. It is also proven that a correct diet, introduction of supplements, lifestyle changes, and exercise can help in managing osteoporosis. In addition, medical devices such as hip protectors can reduce the number of fractures.
In order to prevent osteoporosis, children and adults should ensure a nutritious diet rich in calcium and vitamin D, exercise regularly, and avoid smoking, excessive alcohol consumption, and undernutrition. When it comes to building strong bones, there are two key nutrients: calcium and vitamin D. The amount of calcium we need to consume changes at different stages in our lives. Calcium requirements are high in teenage years as skeleton grows rapidly and needs more building blocks. With age, the body's ability to absorb calcium declines. As is defined by National Osteoporosis Society UK, top 10 calcium-rich foods are milk, yogurt, cheese, almonds, sesame seeds, orange, soybeans, cinnamon, spinach, and lady's finger. In order to properly absorb calcium and maintain good bone health, the body needs vitamin D. Recommended amount for children in the UK is 200 international units a day. Adults require 200 to 400 and elderly 600. Examples of sources of vitamin D are natural sunlight, cheese, cereal, milk, and fish. Exercise is also important in prevention of osteoporosis, and it helps to build strong bones in childhood, prevents bone loss, and increases balance and posture. It is important that exercises are discussed with medical professionals and suited individually regarding person's age and health condition. Other factors such as smoking, alcohol, and undernutrition were proved to interfere with bone peak mass as well as the process of bone fracture healing.